Cranial nerve 1 is the olfactory nerve, which is sense of smell. We start by having the patient smell something. In this case, we are using an orange. Then the clinician asks,
"What do you smell?" "I smell an orange."
This correct response indicates that the olfactory nerve is within normal limits. Cranial nerve 2, the optic nerve, is the sensory nerve for vision. We have the patient cover one eye and read letters off a paper.
P, B, D, F, D, P, Q, D.
Then ask them to distinguish how many fingers are being shown.
4.
Peripheral vision is also tested by having the patient look at the clinician's nose and moving the clinician's fingers superiorly and inferiorly into the peripheral fields. The flashlight test examines cranial nerve 3, the oculomotor nerve. We use a flashlight to check pupil constriction. The pupil should be smaller when the light hits the eye, indicating brain function, vision focus, and improved vision. Cranial nerve 3 also controls the eye's extraocular muscles. We examine the patient's eyelids for any drooping. It is easy to test cranial nerves 3, 4, and 6 together. Cranial nerve 4, the trochlear nerve, pulls the eyes medially, and cranial nerve 6, the abducens nerve controls the eye's side-to-side movements. The clinician asks the patient to keep their head still while following the clinician's finger with their eyes. Cranial nerve 5 is the trigeminal nerve, which is responsible for sensation in the face and motor functions such as biting and chewing. The patient is asked to close their eyes while the clinician lightly touches different parts of the face. In this case, we are using a cotton swab.
Right cheek. Right chin. Left cheek.
Also, make sure to check the patient's jaw strength. The clinician puts a little bit of resistance while having the patient open their jaw. Cranial nerve 7 is the facial nerve. This nerve innervates lacrimal and salivary glands, the stapedius, and muscles of facial expression and taste to the anterior 2/3 of the tongue. Have the patient make facial expressions such as
wrinkle your forehead, shut your eyes tightly, pucker your lips, show your teeth, smile. Okay.
The anterior 2/3 of the tongue can be tested using a tasty tongue depressor.
What does that taste like? Tastes like berries. Okay.
Cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus nerve, can be assessed together. The glossopharyngeal nerve is responsible for the tactile pain and taste to the posterior 1/3 of the tongue and innervates the tongue and the pharynx. We will ask the client to say ah and to check the movement of the soft palate as well as checking the uvula to see if it is at midline and symmetrical. We would also try to stimulate the gag reflex. The stylopharyngeus cannot be assessed. Cranial nerve 11 is the accessory nerve, which innervates the trapezius and the sternocleidomastoid. We will ask the patient to turn their head side to side and shrug their shoulders. Cranial nerve 12 is the hypoglossal nerve, which innervates all the tongue muscles except for the paladoglossus.
Can you go ahead and stick your tongue out for me? And touch your nose with your tongue? And your chin? And to your left? To your right? Thank you.
We will also examine speech for slurring. Cranial nerve 8 is the vestibulocochlear nerve, which is responsible for hearing and equilibrium. We will ask the patient to walk in a straight line and balance on one leg.